Perfect. Awesome. Well, in the essence of time, we are going to get started. Everyone, my name's Jamie Adkins. I'm the Director of Business Development here at MedShift. And we are so excited to welcome you all here today for our special event with Soneva Medical and our lovely guest speaker, Kimber Arnold, to present on the first FDA Class 2 FDA cleared Class 2 handheld plasma device, which is still the best in technology, the Plasma IQ. So I'm going to jump right in. And before we get straight into our presentation, our agenda today is pretty simple. I'm going to give you a little background on Kimber, our guest speaker, but she is going to present on the Plasma IQ, give you some more information about the device itself, how to utilize it in your practice, and her experience with it. And then we're going to dive into a live Q&A where everybody's encouraged to participate. So very exciting, and I'll also tell you how you can take advantage of accessing that Plasma IQ at the very end of the presentation. But now I'm going to dive into the great stuff. I'm really excited to welcome Kimber Arnold. She's one of the nicest people I've met in the entire aesthetic industry, so we're excited to have her today. Kimber's an expert cosmetic injector. She's got over 10 years of experience, and she currently works for Cincinnati Plastic Surgery, as well as traveling the country as an aesthetic clinical educator. So that makes us very lucky to have her today because she's en route to train as we speak. We've also invited her here today because she's perfected her skills specifically on the Plasma IQ, and she really values the importance of regenerative medicine in the aesthetic space. So that's another key component of this. But for everybody else on the line, I also wanted to share that if you're working hard to boost your marketing or your social presence, Kimber has cracked the code on social media. She's got tens of thousands of social media followers and millions of views, and she's truly become a top aesthetic influencer, both for patients and providers who are looking for education and entertainment in the industry. So we're really excited. Again, thank you, Kimber, for being here. One more thing before we get started, I just want to remind everybody, again, we would love to hear from you. We want your participation. If you have questions during the event, I'll encourage you to type those questions into the chat box, and we will get to those at the very end of the presentation during our live Q&A with Kimber. So with all of that said, I would like to welcome Kimber Arnold.
Hi, guys. Thank you so much for having me. This is such an honor to get to work with MedShift, talking about something I'm very, very passionate about. I love Plasma IQ. I love regenerative aesthetics. I'm in my 11th year of being a nurse injector and an aesthetic nurse. And this is our not so secret weapon at Cincinnati Plastic Surgery. So I'm so excited to talk about it. I've been doing the Plasma IQ pen for several years now. I remember when we were first in talks about bringing it on, when somebody would say plasma, I would conjure up images of, plasma in the blood, but of course this is something completely different. This is fibroblasting, and just for fun, plasma energy. Of course, we're going to talk about the Plasma IQ pin, but some examples of plasma energy would be the Earth's ionosphere, a welding arc, the tail of a comet, solar wind, the aurorae. Those are all examples of plasma energy. So with no further ado, we'll get to talking about my favorite kind of plasma energy, which is our FDA cleared Plasma IQ pin. This is me. I work for Cincinnati Plastic Surgery for a wonderful board certified plastic surgeon. His name is Dr. Curtis Martin. He's wonderful. He's my mentor. He's my friend. And I'm blessed to be a part of that practice. And of course, I am a clinical educator for Soneva Medical, who has my heart. I have been involved with them for many, many years. Prior to being a clinical educator, I've been injecting their wonderful products back in the day when it was a single product that they were carrying, Belafil. So they are very close to my heart as well. Go to the next slide. All righty. So we're going to talk about the difference between Plasma IQ and some other devices that you might have, some other modalities that you might have in your aesthetic practice, in your med spa. But I really compare Plasma IQ to something that's bridging the gap between microneedling and lasers. I like this more than microneedling, which I think microneedling is a fantastic modality as it is regenerative in nature. And I'm a regenerative aesthetics person, but the carbon crust will serve as nature's band-aid. It's a biological dressing. So I really love that because then the wound is closed and it's not leaving open skin vulnerable to bacteria entering. So that's very important to me. And then you always want to underpromise but overdeliver. So while I never promise that you will not require successive treatments or a subsequent treatment, the vast majority of my clients that and my colleagues' clients at Cincinnati Plastic Surgery, as all of the nurses are trained on this, require just a single session, a single individual session. So in my experience, it's typically one and done. And then they reach optimal results. And of course, they have the possibility or they have the right to have a subsequent treatment, but it's usually not necessary. Whereas with microneedling, that could take 3, 4, 5, 6 treatments to reach optimal outcome. The skin is open, the skin is vulnerable to bacteria, and a lot of profractional lasers or other modalities that are on the market require a package of multiple treatments to yield the optimal result. I do love this because it's very, very cost effective. We will have a slide later in our slide deck here that compares this to competitors, if you will, or other modalities that are on the market. But for instance, this innocuous, this innocent little device that can fit in your lab coat pocket, on low power, it actually delves deeper than a CO2. And of course, it doesn't have the downtime that a CO2 would have. So for a relatively low price in comparison, you're getting a really, really optimal treatment, a really strong treatment, and a very effective treatment, a wildly effective treatment with a device that's, pretty inexpensive in the grand scheme of things. It's certainly not a six-figure device sold by a capital company. We can go to the next slide. All righty. So as I mentioned before, this is just a small diminutive little device that can be carried around in your lab coat pocket, your scrub pocket. It's not a large, cumbersome laser that you're dragging from room to room. I tease my colleagues sometimes if they're moving a laser or even have to move a cool sculpting machine that they're pushing a Buick around the office. So this is really nice. And this is ideal if you have multiple practices and you want to kind of transfer it from practice to practice, because a lot of us in the med spa world, in the med spa realm, do have multiple practices or inject or work in multiple practices. So the second bullet point here is that this yields immediate tissue contraction, which is an integral part of wound healing, of course, as we all know. I've completed this treatment dozens of times, if not more, hundreds of times. I'm not sure how to quantify that, but I've seen this with my own two eyes many times, and that immediate tissue contraction, I compare it to saran wrap on a hot dish. It just right before your eyes contracts that tissue. And that's where I think it is really set apart from other modalities that you might consider uh, competition to this one, if you will. And of course, that is an integral part of wound healing, as we all know. But this pinpoint precision, and this is very, very precise, is going to help the provider treat difficult areas like the delicate tissue around the eyes. It's ideal there. That's actually where Cincinnati Plastic Surgery uses it the most. And I would like to talk about that in more detail in a further slide. Also, the delicate tissue over the lip, the cutaneous lip, the vertical lip lines. It's not really putting a band-aid on the issue, but it's addressing it at a cellular level. So when you address something at a cellular level, you're using your body's own processes to create a result. So you're getting a very, very long-lasting result rather than with a neuromodulator, for instance, getting an 8 to 12 week result for the perioral rhytids or smoker's lines, as we call those. And then again, there's no six-figure price tag. I'm happy if anybody's interested to tell you what we paid for our pin at Cincinnati Plastic Surgery. It was likely more than the special you're probably getting, but I am proud to say that we paid it off in 3 weeks. We paid it off in 3 weeks by marketing non-surgical blepharoplasties, of all things. I think that this device really, really shines in the eyes, although it is FDA cleared for skin coagulation. So all of your skin, all of your integumentary system, you can use this on, but that's how we paid our pen off. And I do also like to make it clear that you have a very dedicated rep. It's not a 1099 type of situation where they just want to sell you the device and beat it. They're going to be dedicated to you. We have a fantastic marketing program that I am so proud of. And keep in mind, I'm not just a clinical educator for Suniva. I am heavily involved with a practice that utilizes Suniva's products. So I'm on the receiving end of their services as well, and they are second to none. So you're always going to have that dedicated rep, that dedicated staff, the dedicated marketing department that's right in your corner to help you out. All right, so we're going to talk about a little bit of the science behind it. Plasma is actually the fourth state of matter. We remember from school that, there's solids, liquids, and gas. And then to create each of those, the heat is increasing precipitously, but plasma is actually the fourth state of matter. So there's solids, liquid, gas, then plasma. So we can go ahead to the next slide. There we go. So it is actually the most abundant state of matter in the universe. It is positive ions and free electrons, and you can actually create plasma energy. Excuse me, you can actually create plasma energy by adding energy to any gas. So there's other things out there that you may have heard of that use helium gas or whatever to create that plasma energy, but we are actually ionizing atmospheric nitrogen gas. So it's nitrogen gas that's present in the atmosphere that is creating the plasma energy with our device here, the Plasma IQ pen, which of course is an electrically conductive cloud of ionized gas. Go to the next slide. So this is the physics of plasma. We see that we have solid, liquid, plasma, and gas. What we're doing here is actually epidermal sublimation. So we are turning a solid to a gas without the transitional liquid phase. So when you use this device and have pinpoint accuracy on your target, let's say it's around the eyes, let's say it's the crow's feet, for instance, there of course is no transitional liquid phase. You will quite literally see poof, a little poof of burnt skin, if you will, vaporizing the outermost layer of skin in a very controlled injury. You can even smell it a little bit. I call it the smell of success. And that's what we're doing here with the plasma pen. We'll go ahead and go to the next slide. Okay, so again, we are using any gas can be ionized to create plasma energy, but we are using nitrogen gas. So you are creating a little arc with our lovely little device that you see here, and you see a curved probe that's on it. And this graphic, this photo of this client, this patient, this is a very, very ideal treatment of how the desiccated carbon crusts or the scabs should be placed, but it's an arc of plasma gas. And it doesn't fire, if you will. The electrical arc is not created until you get the tip within 0.5 millimeter to 1 millimeter above the skin. And it's non-contact. So this probe, as you see here, it's showing the curved probe, that is actually not touching the skin. So it's non-contact, so it does not pierce the skin, it does not touch the skin, it does not break open the skin, if you will. It's just a very close proximity to the skin's surface. So, of course, we're creating a small thermal wound and leaving that carbon crust. So here we have some wonderful graphics that show the effects of our Plasma IQ pen, but you are going to vaporize a precise point of the epidermis. That was the little poof I was talking about, the immediate skin contraction. But then, very importantly, we are activating existing fibroblasts. We know, of course, that fibroblasts are the cells that deposit and build collagen in our dermis, and that's what we are targeting here. So we are producing new collagen and we have long-term neocollagenesis, and the skin just gets more and more beautiful over time. So it's kind of the gift that keeps on giving for the next 10 weeks or so. Go ahead and go to the next slide. So we're causing immediate tissue contraction and thermocoagulation. I do like to point out that the heat is being absorbed by the tissue being targeted, and it's not spreading to the surrounding tissue with each precision point electrical arc and desiccated carbon crust, the tissue or the scab. And there's an irreversible injury to the epidermis and dermis. That's what the scab is from. That's the ablative portion. And then the plasma energy is going down into the dermis. If you treat on high, it's going to go to the reticular dermis. If you treat on low, the papillary dermis. I will elaborate on that further. And that's going to stimulate the fibroblast because that's the layer in which the fibroblasts are present. So the natural Band-Aid that I was talking about, the biological dressing, those little carbon crusts are going to be there for about 5 to 7 days on average. And they, of course, are eventually going to fall off, but those are going to be present, protecting the skin underneath during the regenerative healing process. And of course, the fibroblasts are going to create new collagen to help restore the skin. So this is actually a really good slide. I love our histology data. We are very steeped in science at Suniva Medical. So we have a lot of published data, but I want you to focus on the histology data with the graphic on low power versus high power. On low power, we are penetrating down to the papillary dermis, and on high power, we are going down to the reticular dermis. It is our desired a way to train, to teach. It is what we certainly suggest that you do, is to treat on low power, because our histology data has shown that whether you treat on low or high, the thermal spread is the same, which is the non-ablative thermal energy. So if you treat on low, although it is at the discretion of the provider ultimately, but if you treat on low, the thermal spread is the same. So you will be getting the same result. It's going to yield the same result without a prolonged healing process. So in Cincinnati, that's how I treat pretty all of my clients. I treat everybody on low, and I have had this treatment myself, and I have certainly been treated on low myself as a skin type 2. So regardless of the power setting used, the thermal spread is the same. And let's go ahead and go to the next slide. So there are factors that may impact the plasma IQ. Of course, the length of the pulse duration. We are recommending 1 second. And if for whatever reason, as it is at your discretion, you decide to treat on high, I would actually recommend half of a second. And we'll go further into that on another slide. The number of passes, of course, is going to have a lot of impact. And then the setting, which we talked about, high or low. We do recommend low, as the thermal spread is the same. And then, of course, the anatomical location, age, and thickness of the skin is a variable. In my experience using this device and performing this treatment, commonly, the further you get away from the face, the longer it takes to heal. We do a lot of body in Cincinnati plastic surgery. We do a lot of stretch marks with this, knees. In my experience, the scabs take about a couple days longer to fall off, and the little bit of erythema, the redness, perhaps lasts a little bit longer than it would on the face. You can go to the next slide. This is my favorite. This is my favorite slide of all of them. I think I may have referenced this in the beginning of our conversation, But here's other energy-based devices that we're all heard of. We've all heard of. But here towards the left of the graphic, we have our ablative devices. And I think you remember me saying, or at least I did say, that the plasma IQ on low is actually deeper than a CO2. It's actually deeper than a YAG. And if you were to treat on high with a non-ablative device, it's about as deep as an IPL. And then you can see the other modalities that are present here. So for a very, very cost-effective device that fits in your scrub pocket, you are packing a really big punch with this treatment. You are yielding wildly effective results that, while we would never, as clinicians, promise that they would get a result that would rival, say, a blepharoplasty, a surgical one, I have certainly seen results that rival a blepharoplasty. And I'll show you real life clients of mine that I've done that on in later slides. Okay, here we go. So this is the first FDA Class 2 cleared handheld plasma energy device. We're very, very proud of that. You know, I've gone through all of the science, so you know all about the skin rejuvenation with it now and the body's natural healing process and how it's a non-surgical solution for things that our clients are asking for, of course. But I'm really proud of our exclusive marketing program that we have, our distribution program, the educational support, hands-on training, and our warranty, of course. And then I've been in this industry for a long time. I really love the partnership that you build with a smaller company that's really focused and just, you know, really wants to see you grow and thrive and kill it, of course. You can go to the next slide. So this is our pen here. This is how it comes. This is how it's delivered to you. This is the size of a plasma IQ pen. You know, it just fits in your hand. It needs to be grounded, of course, but it's impossible to do the treatment without doing that. And here's one of our probes. Those are single use. It comes with a docking station, a charger. I keep mine in the med room locked up on the charger all the time unless I'm using it. And then, of course, you'll need your electrodes. You can purchase straight or angled. Those both yield the exact same result. It's just personal preference and ergonomically if you prefer holding the straight or the curved electrodes or probes. I prefer the curved, for instance, but I've worked with practices that prefer straight, but that's completely up to you. You can order whichever one you want. The electrodes, the probes are single use. They are one per client. However, that electrode can be used all over. And then I want to say they're around $60. Correct me if I'm wrong, but I want to say they're very inexpensive. And then we did pay our pen off in you know, just a matter of weeks. So when we have a, you know, a $500 or $600 non-surgical upper blepharoplasty, we're using a $60 disposable probe that we put in sharps afterwards, and the rest is profit. So this is a very wonderful modality to have in your practice. There is a high and low power. It's just a simple button that you press, as you can see on the right there. Default position is always off. Even if you are standing and holding the high or low power button and the button was flashing that it's on, it's not going to fire until you get within 0.5 millimeter to 1 millimeter of the tissue of your skin or of your client's skin. So it's very, very safe. It would be very difficult to, you would have to be very reckless to hurt somebody with this. It's very easy to operate. We can go to the next slide. These are the electrodes I was talking about. Again, they yield the same result. They both have wonderful outcomes. It's just ergonomically what you prefer. If you prefer the straight or if you prefer the bent. I like the curved. If I'm doing a long treatment, it's just easier for my wrist. These are the only ones that are compatible with our plasma IQ pen. However, so you don't want to order something that you find off Amazon or anything like that. You do need to use these, especially for your patient safety. These are, for instance, some that are not compatible with our Plasma IQ pen. So you'll want to make sure that you order those through through your dedicated sales rep, depending on what part of the country you're in. We have wonderful sales reps in every community. So in order to get the Plasma IQ pen ready, you're just going to turn the spindle. You're going to basically place that sterile probe in until you feel resistance, and then you tighten it up, and then it's ready to go. Okay, a targeted approach for small areas with a big impact. Delicate skin on the face. We do use it on the eyes. That is the most popular, if you will. We do use it everywhere, but the eyes are the most popular, at least in my practice. I love this around the mouth, tightening up what people colloquially call the smoker's lines, even if you haven't smoked. It works great for that, and it offers a long-term solution rather than just putting a Band-Aid on the problem. And this is FDA cleared for the removal of lesions. As you can see, Dr. Martin in Cincinnati does permit me to remove skin tags. However, if it's a pigmented issue, you would want to discuss with your medical director. That would be at your discretion. But I do kind of lift a skin tag up and at the peduncle at the base, use the Plasma IQ pen in it, and it removes it beautifully. But those are the only lesions that I'm removing in practice. However, it is FDA cleared for the destruction, the removal of lesions, and the coagulation of skin tissue. Okay, so contraindications. Let's really briefly, okay? So this is not to be used on birthmarks or port wine stains, warts. The last thing you ever want to do is vaporize a wart and breathe in that virus, right? So we don't want to be using this on warts. This is not meant for tattoo removal. This is not meant for hemophilia, autoimmune disorders, proceed with caution, I will say. Fitzpatrick's skin types 4, 5, and 6. This is FDA cleared for skin types 1, 2, and 3. If you have any questions involving any other skin types, I would just encourage you to ask me how I utilize it in practice. This is arguably the most important one to me. Anybody with an implanted pacemaker or with metal or electrically conductive implants. For obvious reasons, we can't be using this on those people. Cancer, pregnancy or breastfeeding, studies have not been done on any pregnant or lactating mother, as you can imagine, so let's avoid that. Cardiac disorders, cardiovascular diseases, that's a very broad term, as hypertension would technically fall into that category, and everybody's on lisinopril or ACE inhibitors, one of those, but whatever you're comfortable with your medical director. Uncontrolled diabetes, in practice under the direction of Dr. Martin, I do treat diabetics if they are well controlled. Circulatory disorders, active herpes or shingles. If clients coming in with active shingles, they're probably writhing in pain and don't want any treatment, in my humble opinion. And then skin disorders such as psoriasis, eczema, dermatitis, and vitiligo. This is a contraindication for. And then we don't want to use this on hypertrophic keloid scars or previous occurrence of keloid scars. And then with precautions, we want to consult on, in your consultation process, you're doing this in med spas for everybody anyways, but hyperpigmentation, uncontrolled epilepsy, anemia. It just went, let's get rid of this. My screen just went a little bit blank. So give me 1 second and try to fix this. And we're back. Thank you for that. Sorry about that. The MacBook can sometimes be a little unpredictable. Eye conditions or prior surgeries, treatments, toxins, chemical peels, retinols, dermal fillers in the treatment area. I do want to put a little caveat of advice there. I get asked this a lot. Although this is bridging the gap between microneedling and lasers, I do use the same rule of thumb. Usually 4 to 8 weeks, 6 weeks is kind of the happy medium there, where I have them wait in between fillers, uh, in this or any other laser for that matter. Not toxins, however, toxins are going to absorb into the muscle within about 4 hours. Well, I would not do this the same day, but I would treat them when they're able to come back in, perhaps after the toxin kicks in, or before you treat them with toxin and have this heal up, and then have them come back in and inject their neuromodulator. If they have a topical anesthetic intolerance, you would want to have that discussion. Or if they've had recent surgical procedures. And then contact lenses are recommended to be removed before the procedure. Okay, so here's some risks with it. Swelling and bruising, that can happen. Swelling though, edema or swelling is actually aids in the fibroblast process. It's not necessarily a bad thing. You're gonna, especially around the eyes, you're gonna experience some swelling after this procedure. So I usually recommend my clients avoid any NSAIDs or anything that's going to quell that inflammatory response, as that aids in the fibroblast process. And of course, we are triggering those fibroblasts to build all of that collagen for us. Scabbing and crusting, skin discoloration. So we don't want to cause any hypopigmentation. I have never done that on a single client of mine because I have done our recommended protocol, which is the 111, which I think is on the next slide. Scarring could happen. In order to really reduce any possibility of this, I would encourage you to go by our protocol, and really at the patient responsibility. As those scabs start to fall off, you can't pick at the scabs. That would cause that would not cause an auspicious result, and that would cause potentially scarring or an unwanted outcome. And then redness or tenderness. You're going to be a little tender after this procedure. It just feels a little warm, although in my opinion, it's a very comfortable procedure. So during the patient consultation process, of course, you're going to ask them why they're interested. What indication does the patient want to address? What's bothering them? Is it the skin hooding on the eyelids? Is it crow's feet? Do they want a lip lift? Do they want to address acne scars, stretch marks, whatever it is that they are looking to do? And then discuss the number of treatments that would most likely support this level of change. In my experience, this is primarily one and done. However, I always tell them in the consultation that there is the possibility that successive treatments may be necessary in order to achieve their optimal result. And the big one, what's a typical recovery process look like? They're going to have those carbon crusts for 5 to 7 days. Obviously, you want to have that discussion with them, especially around the eyes. They are going to experience some inflammation, some swelling for a couple of days. Go over that with them. Absolutely. Under promise and over deliver. We don't want to promise surgical outcomes when it's not a surgery. Will they need retreatment? You never want to promise a facelift result. This is not a facelift, and don't expect surgical outcomes. Although I have seen some eye treatments that definitely give blepharoplasties a run for their money. Pre-treatment recommendations: definitely avoid sun exposure or tanning beds for 2 to 4 weeks. If you're in my practice, I say avoid tanning beds for the rest of time. But ideally, this is what you need to do prior to treatment to have the most auspicious result. And then you want to apply SPF, of course. Wash your hands. This is, I know everybody that's on this webinar is doing that. You have to wear gloves. This cannot be operated without wearing gloves. Have the hair out of the area. You need to make sure that everything is cleansed off their skin and that after you clean off the topical anesthetic, let it dry. And we can go to the next slide. So this is our recommendation, is the low power setting. The high power setting will have a deeper ablative wound. It is at your discretion, of course, as the provider. But if you do want to use the high setting, the pulse duration should only be about a half a second. Make it a quicker pulse duration. And do keep in mind that the thermal spread is the same. And that has been studied significantly with histology. And our data has proven that. So the thermal spread is the same whether you use high or low. We can go to the next slide. There we go. Make sure the device is properly cleansed, battery fully charged. I just keep mine on the charging port all the time. You want to make sure that the high and low buttons are functioning properly, and attach your single-use electrode. Activation, so just proper device, make sure that the high or low is working before you go in and perform this treatment. Your gloved hand must also be in contact with this oval-shaped metal plate. That's what I was talking about, grounding it. The procedure is impossible to do, in my opinion, without touching that, being in contact with it. So I wouldn't worry too much about that. And then yeah, let's go to the next slide. So treatment techniques, you can use a topical numbing cream. Most people use a BTL or whatever your preferred numbing agent of choice is, a medical grade, prescription grade numbing cream. And you want to create multiple small, precise coagulation zones or precision points that you see here. It should look like a little strawberry, in my opinion, or if you do the eyes, it looks like a panda when you're all done. Some people might need to use surgical loops, but it is very precise. So you need good visualization. And that's an appropriate spacing of the dots or scabs, as you see here. So this is the recommendation. This is the best protocol that you could possibly do in any given treatment setting. So you want to do the best practice 1, 1, 1. Very easy to remember. A 1 second pulse duration, unless you are treating on high, and then we recommend a half-second pulse duration. So 1/1000, just 1 second. And then the coagulations are zoned at least 1 millimeter apart. They should not be touching. As you can see on this client, those are spaced apart around 1 millimeter. And the tip of the electrode will be 1 millimeter away from the skin surface. It actually won't fire. You won't create the electrical arc or ionize the atmospheric nitrogen gas until you get that close to the skin anyway. Okay, we can go to the next one. So this is actually really important. The post-treatment care, you do need to have an occlusive balm, and you need to apply that at least twice a day until the scabs have fallen off. We can talk about different occlusive balms. Petroleum jelly is actually fine though. Aquaphor would be fine. If you have a vested interest in a specific skincare brand that you carry in your med spa, a lot of them have wonderful products that would be appropriate for use after this treatment. You will experience a little bit of stinging in the treatment area immediately following treatment. This is normal. It's not bad. It's very minor. It's very mild in the grand scheme of things. So I do tell them that. You want to apply that moisturizer or occlusive balm twice a day after gentle cleansing. You can put additional moisturizer on as needed, or if dryness occurs, or I just say apply the Aquaphor again, apply the occlusive balm again, more than twice a day. I do recommend gentle cleansing and patting dry very softly with a very clean towel or a washcloth. Blot it with a paper towel perhaps. Definitely don't pick or scratch at the scabs. This could delay healing, and that could also cause scarring. And then you don't want any sunlight, exercise, heat, or steam, or sweat for 48 hours post-treatment. After 2 days, begin applying your SPF to the treated area daily. You can put that directly over the occlusive balm. And then no makeup, mascara, or creams other than sunblock on the treated area until the scabs have completely healed. They will literally fall off. And that takes approximately 1 week, depending on the area on the body that you've treated. Make sure that you're cleaning your Plasma IQ device in between treatments. They may don't use abrasives, don't use free chlorine and oxygen. Those could damage the case. And this just gives you some information about what you can clean it with. The post-care recommendations, and this is just it. In a tangible form that you can print out, we can provide this to you. And I would just hand this, the first one, this, the post-care anyways, to your clients. I would just hand that to them tangibly. And then, yep, this is another thing. I hand this out to every single client that I treat. So let's go through some before and after photos. These are actual clients that I've treated in Cincinnati. Here's a little, I don't know, can we put is there a sound on that? This is it's okay. This is a TikTok that I've made, and I put a lot of my TikToks onto Instagram as well. I'm very, very active on social media. I believe in it. I think you should find your niche on there and go with it. It's free. We get a lot of clients that are referrals just from my Instagram or TikToks, at no cost to us. So it's fantastic. And the vast majority of these clients, if not most of them, if not all of them, they tend to do other modalities in the practice as well. They may even transfer over to the surgical side and get a breast augmentation. So I absolutely recommend that you utilize social media and find your niche on there. Make it fun, make it educational, use before and afters. It's great. It's definitely worked for us. So here's a client that I treated. She's a Fitzpatrick skin type 2. I did add her during. This is her the day after. So this is before, during, and a full 10 weeks later after all of the neocollagenesis has occurred. So she has some pretty significant hooding, and some, some laxity on her lower eyes as well. So look at the middle picture. That's that inflammation that I was talking about. It's going to happen around the eyes. And she called me. This is actually a nurse practitioner, and she wanted to give herself a steroid shot. And I said, no, please don't. Just let it run its course. And she was, she had the inflammation for 2 or 3 days, and it dissipated, of course, as time went on. And I said, let that aid in the fibroblast process, let it heal itself. And she did. She listened. And this is her 10 weeks later. And she looks incredible. She is thrilled with her results. Let's go to the next one. Another client. She was treated just on her upper lids. We do market this as a non-surgical blepharoplasty. And she was bothered by her hooding. She didn't want to wear mascara anymore. So we treated her on low power on the upper eyelids. And this is her 10 weeks later. I do like to take the photos between 10 and 12 weeks later to show full, the full result, if you will. Let that collagen build. These are knees. This is incredible. I love this. This is actually before and a full 9 months later shown. This client she's been to the beach or she's had a spray tan, but this is a former dancer. She was really bothered by her knees. She was getting a lot of treatments on her face in the practice. And she said, is there anything we can do about my knees? And I said, that is also a loss of collagen. We need to tighten the skin, immediate tissue contraction, neocollagenesis. We did this treatment, and you can see a full 9 months later how fantastic it looks. And go to the next slide. I call these accordion lines, as if you were playing an accordion, right? These kind of lines that develop on the side of the face. I don't like to put a lot of filler there on a female, especially. I think that can make the face look masculine. So this is a wonderful tool to use to tighten that area up and keep most of the volume at the top of the face. She's shown 1 week later. You can see that the scabs have fallen off. She has a little bit of inflammation left, but you can also see, if you look closely at her perioral lines, above her superior lip, that was also treated, and how nice and tight they look right now as well. Can we go to the next slide? Oral commissures. This client is in her 60s. Um, I will put some of I do treat the oral commissures with some filler too. I use Bellafill there. However, this is another modality that I like to use there to tighten things up, especially on a female where I don't want to bulk up the lower half of the face with too much filler. I like to keep the triangle of youth. So this is actually 4 weeks later. So this result actually got even better after what we're seeing here, but this is a month later. And her perioral lines were treated as well. Acne scars before and a full 9 weeks later. This looks fantastic. I also treated her nasolabial folds. Beautiful. This client, she has beautiful skin. She didn't have any lines, so to speak, but she wanted a lip lift. She was coming in and seeing me for toxin every 3 months. And while her neuromodulator would last 3 months, her lip flip toxin would only last about 8 to 10 weeks on average, no matter which one we tried. So we opted to do Plasma IQ, and you can see immediately how it has averted her superior lip up. You see, we haven't added any volume, of course, but we have tightened it up. We treated that area, got very close to her vermilion border without actually treating the vermilion border, and it has everted the top lip up. So she got a long-term lip lift with this, and I treated her oral commissures as well. So this is the client that you saw previously. This is acne scarring. You can see her immediately after. She's a little bit swollen. She's a little bit red. Those are the nasolabial folds I treated that I mentioned. That's an appropriate spacing of thermocoagulation zones, the precision points, the scabs. They're about 1 millimeter apart. And then 9 weeks later, she looks incredible. This is the same knees that you saw before. This is the ballet dancer, just a longer view. And okay, here's a good one. This is 5 days later. On the left, you can see the significant hooding that she has, and then 5 days later, she was treated upper and lower. You can see that the hooding is all but gone. So that's pretty incredible. I think we have a photo of this client at a later stage of her healing too. So yep, this is okay. So before, and then this is 10 weeks later. So it continues to get better. So while I don't promise a surgical result, I think we can all agree that this, if it's the appropriate client and they have realistic expectations, this does rival a blepharoplasty. I work for a brilliant surgeon that performs blepharoplasties all the time, and he says the same thing. He loves this treatment that he can delegate to his staff and offer to his clients if they're at that stage where they don't need a surgical blepharoplasty yet. So that's the full 10 weeks later. We can go to the next. This is, kind of a progressive photographic diary, if you will. If you pay attention to day 2, there is some significant swelling. Day 3, the swelling starts to go away. Day 5, the scabs have fallen off. Next slide. This is an abdomen. This is a mom of 3 who was fortunate not to get stretch marks. I would like to say that this is very effective on stretch marks, but her skin is just not what it once was after having 3 babies. Around the belly button and in the upper abdomen. So this is a progressive photographs. You can see directly, there's baseline, and then you have 1 day after, 3 days after, 4 days after. This last one you see, this is 7 days post. The scabs have fallen off, but she's still a little pink. That's normal on the abdomen. The face heals a little bit faster, but I think the next slide has her final result. There she is. Yes, this is a full 10 weeks later. And this one you can see, it's a little higher resolution. You can see her baseline where the wrinkling was, where the skin just wasn't as tight as it probably was when she was younger. But 10 weeks later, that's pretty profound. That's incredible. And that we actually have, I'll put it on social media. I think it's on LinkedIn, 1.5 years post photos for this client. And they're every bit as good, if not better, as at 10 weeks. So that's pretty incredible. Let's go to the next slide. So, in summary, this is a great device. You can broadly deliver pinpoint precision on all skin. It's very simple and easy to learn. It's very delegatable in your practice. A quick return on investment, the ROI is incredible. It really does pay for itself really quickly, and the results are incredible and impactful.
So we are right at the end of our presentation, and Kimber, that was fantastic. Thank
Thank
you for all
you.
the great information. But I want to encourage everybody to stay on because we are going to do a live Q&A. I want to encourage everybody to jump right in and ask questions. I did see a couple that came through during the presentation, and I think it was when you talked about someone you were treating in their skin type, Kimber. And they asked what other skin types can be treated beyond 1 through 3.
Sure. No, I'm actually really glad you asked that. So, as somebody who represents Suniva Medical, I do want to preface it by saying this is FDA cleared for skin types 1, 2, and 3. However, it's Cincinnati Plastic Surgery, and I have seen this in various practices that I've worked with over around the country. I personally am successfully treating skin type 4s very, very commonly. So what I do is I do treat skin type 4s very, very frequently, is I require them to stabilize their melanocytes with hydroquinone for a minimum of 30 days before treatment. And then I would not treat those skin types on high. I would only treat them on low. I do the 1 second pulse duration, and they are healing so elegantly, just beautifully. Some of the best results I've seen have been on skin type 4s in Cincinnati with that protocol, that hydroquinone protocol prior to the treatment. I would say a minimum of 30 days, but even up to 6 weeks. Um, yeah, I don't treat skin type 5 or 6 though, 5s or 6 though. My husband, for instance, he's from Bogota, Colombia. He's a skin type 5. I wouldn't put it on anybody with that skin type. Or
That's
don't.
great. Great advice. Definitely great advice. And a great scenario too to share.
Yeah.
We got a couple more here. What other products or procedures do you like to use with your plasma pen?
That's a really good question. So, I am a nurse injector. However, I am very passionate about medical grade skincare that pretty much all med spas are carrying. And this is a spa group here, right? A med spa and medical group here. So I really like to roll that in to the quote that I do with Plasma IQ. So you take that as an opportunity to get them on the regimen, require it if you want, or whatever medical grade skincare. There's so many wonderful ones out there. There's Alastin, there's Zio, there's Skin Medica, there's Skin. I have no vested interest in any specific one, but if there's something you want them to use prior to their treatment that's going to yield a better result, or additionally, to use as their occlusive balm or their healing application afterwards, roll it into that quote when you're giving them a quote in the consultation period for Plasma IQ. I definitely recommend that. Another thing I like to pair this with is you can get very creative. I love all of the regenerative aesthetic modality. We do a lot of Bellafill, Ceriglow, threads, things like that in our practice. So I get creative to give them kind of a global, for instance, if they're getting nasolabial folds with our Bellafill, I might have that conversation with them about, perhaps I can incentivize them to get Plasma IQ for their perioral lines and use that, incentivize them by giving them a discount, kind of pairing them together in in one fell swoop, in one quote, and treating them the same day. While I would not treat filler and Plasma IQ in the same anatomical area in the same day, I would definitely treat filler in one area and Plasma IQ in a different anatomical area.
I think that's actually a good lead into our next question that we
Okay.
got, which is about charging patients. It says, how do you charge your patients per treatment or in packages?
So I actually charge per treatment, and I'm an advocate of having packages, but we have done this so much and it's so successful with one treatment that we're basically at $500 per area. So and if they want to come back and have a successive treatment, it's very rare because they're usually happy after one. I might give them, 100 to 200 off or something like that. But I consider the upper lids one area. I consider the lower lids one area. I consider, the perioral lines one area. So I do have a lot of autonomy with it and in practice because it's pretty much just profit for us at this point. So what I do is I incentivize them to get more areas. Um, with the upper lids, which is our most popular area that they're being treated on, I will incentivize them to get the lower lids by doing a BOGO or a buy one, get one half off. So for 25, 30 minutes of my time, that's essentially a $750 area with only the cost of a $60, $65, somewhere around there, probe or electrode. And then if it is stretch marks, we do or something, we do that takes a lot longer. We do increase the price. Stretch
That's
marks are usually around 1,500.
okay. No,
Hmm.
that's fantastic. And I just to tag on to that, we do at MedShift, we do sell the probes, we sell the equipment, the device itself as well, and the
Good.
probes are
Okay.
$65 a piece. So
I was
like you
close.
said, there's a big upside here in terms
Yes.
of what you're charging versus what it costs per patient for a
Yes.
probe. So that's great news.
Absolutely. And the probe
Yeah.
really is one use per patient. So it's only going to take one probe for that patient. It's not going to take a probe for the upper lids and then for the perioral lines and then for the necklace lines. You use one probe for the entire treatment.
Yeah, that's great
So
news.
it's very
And
profitable. Hmm.
yeah, absolutely. And we have one final question.
Yeah.
You touched a little bit on this, but
Okay.
what's your best advice for marketing or selling the plasma treatments to your patients?
Right. So I like to well clearly I'm definitely an advocate of social media. I like to get on there and I like to use buzzy hashtags that are out there like fibroblasting, plasma IQ, and then I like to piggyback on it by saying that this is the FDA cleared one. So I do like to get out there and be very visible with that. We do a lot of email blasts. We are not afraid to diplomatically suggest this to clients um, in-house that are perhaps getting toxins around their crow's feet, and rather than increasing their dose, we're just, hey, you have an area of opportunity here. What if I introduced you to something that addresses that in a different way, without hurting their feelings, of course. So we do a lot of social media marketing. We do a lot of in-house marketing, and there's a lot of word of mouth too with this treatment because not everybody is lucky enough to have it.
Well, that's great. I think that wraps up the questions that came in.
Okay.
Certainly, if anybody else has questions, Kimber shared with us that she is happy to take those offline. If you have a little more information that you want to get from Kimber about how she uses the device in office, again, feel free to scan this QR code. You can learn a little bit more about Plasma IQ. We do have an incredible e-commerce store, and Suniva's been so amazing to partner with MedShift to allow us to sell it and to help you get set up. And of course, Suniva has amazing marketing and training for you as well. So again, don't hesitate to reach out, but we really appreciate you taking the time to join us today. Kimber, that was a lovely presentation and
Thank
great
you,
information.
Jamie.
And again, thanks to Suniva for the great partnership. We wish you all a great day. Thank
Bye.
you. Bye bye.